Hello, I'm Dr. Divyashree, consultant psychiatrist in Optima Super Speciality Hospital. Today, I want to talk to you about anxiety disorders. What are anxiety disorders? So, anxiety disorders are a group of disorders where there is a tendency of the mind to predict negative outcomes in the future. So, a lot of diseases fall under this spectrum. There is panic disorder where there can be intense episodes of anxiety. There is OCD where people keep doing things repeatedly. There is generalized anxiety disorders. But what is important is for us to know what are the symptoms and what to do with it when you have anxiety. Anxiety disorders, there are two kinds of symptoms. One is physical symptoms. So patients with anxiety disorders sometimes complain, most of the times complain of palpitations, that is heart beating very fast, as if something is going wrong, something terrible is going to happen. Difficulty breathing, muscles becoming so tensed that you start developing body pain. Some people complain of a queasy feeling, butterfly feeling in the abdomen. So they go to the gastroenterologist saying something is wrong with my tummy. Sometimes abdominal pain, wanting to rush to the bathroom again and again, which we've put under functional bowel syndrome. So these are some sweating excessively, tremors in the hands. So these are some physical symptoms that can happen in anxiety disorders, which can be misinterpreted as a physical illness, and patients can go to doctors, other specialty doctors, who will send the patient back to a psychiatrist. Now these symptoms are associated with psychological symptoms. What are the psychological symptoms? Predicting things to happen negatively to you, which we call catastrophization. That is, predicting nothing will go right with me. I might end up, this might be heart attack, I might fall down and die, maybe I will faint and there will be nobody to take care of me. Things which are disproportionate to their reality. So physical symptoms and psychological symptoms come together, and the patient, obviously when you are predicting negative things to happen to you and you are experiencing these distressing physical symptoms, you will not be comfortable and there is distress. So this is, in simple words, anxiety disorder. Now we know that through research that anxiety disorders is because of a chemical imbalance in the brain, and the key chemicals that are deficient is serotonin and noradrenaline, which give rise to the physical and psychological symptoms. So the way to treat anxiety disorders are twofold. One, depending on the severity, medications, what we call SSRIs, or selective serotonin reuptake inhibitors, and SNRIs, selective serotonin and norepinephrine reuptake inhibitors, which increase these particular chemicals in our brain and reduce, I will say, psychological and physical symptoms. And so these are very safe medications, and this has to be taken as prescribed by the doctor for the duration prescribed. And the other form of therapy is psychological, that is what we call therapies, cognitive behavior therapy, that is teaching the patient to challenge this negative style of thinking and teaching the patient to relaxation exercises. Along with that, certain lifestyle modifications like learning to cope with stress and exercising regularly, keeping a well-balanced schedule, that is a little work, little relaxation, some time with the family, good night's sleep. All these are important forms of management. Thank you.